Greetings everyone, my name is Nurul Anashahara binti Yusuf, BN251102223. Today I'm going to present about coronary artery disease. Let's go! So, coronary artery disease is one of the most common cardiovascular diseases worldwide, including in Malaysia. It occurs when fatty deposit, known as plaque, build up within the walls of coronary arteries. These arteries are responsible sorry, for supplying oxygen-rich blood to the heart muscle. As plaque accumulates over time, the artery becomes narrowed or blocked, reducing blood flow to the heart. As the disease progresses, the heart may no longer receive enough oxygen to function properly. This can lead to chest pain, heart attacks, heart failure, and in severe cases, sudden cardiac death. According to the Department of Statistics Malaysia, ischemic heart disease was responsible for over 17,421 deaths in 2024, according for 13% of medically certified deaths, making it the leading cause of death in the country that year. Therefore, increasing public awareness about CAD is very crucial, especially regarding its causes, symptoms, prevention strategies, and available treatment. Now, let's move on to normal cardiovascular physiology. Before understanding the disease process, it is very important to understand how the cardiovascular system normally functions. The cardiovascular consists of the heart, artery, vein, and capillaries. Its primary role is to transport oxygen, nutrient, hormones, and waste products throughout the body. The heart itself is a muscular organ that continuously pumps blood. To maintain this function, the heart muscle, known as the myocardium, requires a constant supply of oxygen and nutrient delivered through the coronary arteries. Let's talk about the function of coronary circulation. The coronary arteries supply the myocardium with oxygen and nutrients needed for the construction. Unlike other organs, the muscle must work continuously throughout life, making a constant blood supply very essential. In heart, we have two circulation loops. The first circulation is pulmonary circulation. Its function to oxygenate blood in the lungs, while the systemic circulation delivers this oxygenated blood throughout the body. Normally, there is a balance between the heart's oxygen supply and oxygen demands. Oxygen supplies determined by the amount of blood flowing through the coronary arteries and deliver oxygen and nutrients to the myocardiums, while oxygen demands refer to how much oxygen the heart muscle requires to perform its pumping actions, increasing when the hearts work harder. During physical activity or emotional stress, the heart works harder, causing oxygen demands to increase. In response, the coronary arteries dilate and increase blood flow to the myocardium. However, when these arteries become narrowed down due to plaque buildup, they are unable to deliver sufficient oxygen to meet the heart increased demands. This imbalance between oxygen supplies and demands form the basis of many symptoms seen in coronary arteries disease. Now let's move on to the pathophysiology of this disease. The primary cause of coronary artery disease is a process known as arteriosclerosis, which refers to the gradual accumulation of fat, cholesterol, and other substances within the walls of the arteries. The disease process usually begins with the damage to the endothelium, which is the inner lining of the coronary arteries. Several risk factors contribute to this damage, including hypertension, smoking, elevated LDL cholesterol level, diabetes, and obesity. These lead to endothelium to lose its protective functions and increase permeability to LDL cholesterol. Now, we move on to the plaque formation. Once the endothelial lining is injured, LDL cholesterol, often referred to as bad cholesterol, can enter the artery walls and undergo oxidation. This triggers an inflammatory response that attracts immune cells called macrophages. The macrophages engulf the oxidized LDL particles and become what are known as sperm cells. As these sperm cells start to accumulate, they form the earliest visible lesion of arteriosclerosis called a fatty streak. Over time, the fatty streak stimulates smooth muscle cells to migrate into the artery walls. These walls multiply and produce collagen and other extracellular materials, leading to development of fibrous plaque. As the plaque enlarges, it progressively narrows the coronary arteries, restricting blood flow to the heart muscle. During the period of physical exertion or emotional stress, The heart requires more oxygen. However, the narrow arteries cannot adequately increase blood flow, resulting in myocardial ischemia, which means that the heart muscle does not receive enough oxygen. Now we're moving to the plaque rupture and clinical consequences. In some cases, the plaque may become unstable and rupture. When this happens, platelets rapidly accumulate at the site of rupture, forming a blood clot called a thrombus. This clot can completely block the arteries, resulting in a myocardial infarction, more commonly known as a heart attack. Therefore, coronary artery disease is not simply a condition of blocked arteries. Rather, it involves a complex interaction of endothelial dysfunction, lipid accumulation, chronic inflammation, plaque formation, and thrombosis. Now, we are going to talk about the signs and symptoms of coronary artery disease. These are mainly caused by myocardial ischemia. One of the most common symptoms is angina or chest pain. Patients often describe angina as pressure, tightness, heaviness, or a squeezing sensation in the chest. This occurs because of insufficient oxygen force the heart muscle to switch to anaerobic metabolism, resulting in the accumulation of metabolic byproducts that stimulate brain receptor. Though, in some cases, some people may experience stable angina, which only triggered by exertion or when doing physical activity. But it will soon go away when relieved by rest. Another common symptom is shortness of breath. Particularly during physical activity, reduced blood flow can impair the heart's ability to pump efficiently, causing fluid to accumulate in the lung. Patients may also experience fatigue and reduced exercise tolerance because decreased cardiac output limits oxygen delivery to the skeletal muscle. Additionally, coronary artery disease can cause trigger pain where discomfort radiates to the neck, jaw, shoulder, arms, or upper back due to shared nerve pathway. In some severe cases, such as acute myocardial infarction, the coronary arteries becomes completely blocked. Individuals may experience symptoms of a heart attack, including severe chest pain, cold sweat, nausea, dizziness, and lightheadedness. Thus, recognizing these warning signs early is very essential as prompt medical attention can significantly improve survivability. Now, let's move on to the prognosis and complication. The prognosis of coronary artery disease depends on several factors including the severity of coronary blockage, age, existing disease, family history, cancer factor, and how early the treatment is initiated. Many individuals with coronary artery disease can maintain a good quality of life through lifestyle modification, regular medical follow-up, and adherence to prescribed treatment. However, untreated coronary artery disease can lead to serious complications. One major complication is myocardial infarction, which results in irreversible damage to the heart muscle. Over time, this damage may weaken the heart and impair its pumping ability, leading to heart failure. Coronary artery disease may also disrupt the heart electric conducting system, resulting in cardiac arrhythmias, which are irregular heart rhythms. While some arrhythmias are relatively harmless, others can be life-threatening and may lead to sudden cardiac death. Fortunately, advances in medical technology and treatment strategies have significantly improved the prognosis of coronary artery disease. Early diagnosis and appropriate management remain a key factor in achieving favorable long-term outcome. We have come to the next part of this slide, which is the prevention strategies. Since many coronary artery disease risk factors are modifiable, prevention plays a vital role in reducing disease burden. One of the most effective prevention strategies is adopting a heart healthy lifestyle. This includes consuming a balanced diet rich in fruits, vegetables, whole grains, and lean protein while limiting food high in saturated fat, trans fat, sodium, and added sugar. Regular physical activity is also important. Adults are generally encouraged to engage in at least 150 minutes of moderate intensity exercise each week. Smoking cessation is another essential preventive measure, as tobacco use accelerates the progression of atherosclerosis. Individuals should also manage existing health conditions such as hypertension, diabetes, and high cholesterol through regular medical checkup and adherence to treatment plans. By making these lifestyle changes, individuals can significantly reduce their risk of developing coronary artery disease. Now, we're going to talk about the medical treatment. The management of coronary artery disease aims to relieve symptoms, prevent complications, and improve overall quality of life. Several medications are commonly used. For example, antiplatelet agents such as aspirin help prevent blood clot formation by reducing platelet aggregation, while statins lower LDL cholesterol level and help stabilize existing plaques. Beta blockers decrease heart rate and reduce myocardial oxygen demands, making them beneficial for patients with angina or those recovering from heart attacks. Lastly, nitrates work by dilating blood vessels, thereby improving blood flow to the heart and relieving chest pain. Though, in more severe cases, medical procedure may be necessary. One option is percutaneous coronary intervention or PCI, which involves using a balloon to widen the narrow artery followed by the placement of the stent to maintain blood flow. Another option is coronary artery bypass grafting or CABG. During this surgery, a healthy blood vessel from another part of the body is used to create a new pathway around the blockaged coronary arteries, allowing oxygen-rich blood to reach the heart muscle more effectively. The choice of treatment depends on the severity of disease and the patient's overall condition. In conclusion, coronary artery disease is a serious condition characterized by by a narrowing or blockage of the coronary artery due to arteriosclerosis. If left untreated, coronary artery disease may progress to life-threatening complications such as heart attack, heart failure, arrhythmias, and sudden cardiac death. However, through early detection, appropriate medical treatment, and regular health screening, and also the adoption of healthier lifestyle habits, many of these complications can be prevented. Increasing public awareness about coronary artery disease is very essential in promoting heart health, a healthy heart, and reducing the burden of cardiovascular disease in our communities. That will be all from me. Thank you very much for listening.